I must thank ASO through you and your whole team for inviting me to come, and of course for making all the arrangements for this very lovely event. And I hope that as we get into the third day tomorrow, things will only improve in terms of the deliberations in the corridor and of course the presentations here as well. It's not easy organizing a scientific conference. And when one is organized and the weather decides to do what it has been doing and still we are here full room, then really I would ask for a big round of applause to the team and to ourselves for making it here on the second day running. And then the consistency. I'm told this is the third for the exhibition, but the other one is number 20. Yeah, so doing this for the past 20 plus years is not a mean achievement, and we look forward to the next 20 years of success. I must, however, say that global surgery is a growing field, and as it gains momentum, it is really gratifying to see that it is not only gaining momentum where surgical practice is cutting edge, it is also gaining momentum here on the continent of Africa, where although we struggle with facilities, with expertise, with consumables, we struggle with policy, we struggle with patients, many times we struggle with resources of different types, global surgery is taking root and is growing and becoming really an essential part of global health. And for those of us who are practitioners of global health, it gives us a lot of pleasure to see the kind of growth that global surgery has been having over the last few years. So I really encourage ASO leadership to continue to grow the interest in global surgery here in Uganda and reach out to your colleagues across the borders on the continent of Africa to ensure that this growth is sustained in an effective way. Africa, unfortunately, has been bearing the greatest burden of disease and illness, yet the continent has the least access to the relevant services, to experts, to tools, to infrastructure, and to training. Our continent is not only underserved, therefore, but it is also in crisis. A crisis that needs to be addressed quickly and with determination so that we can achieve more for our people and also for global health. This crisis can only be addressed if you and me are part of thinking through the innovative solutions that this continent really, really needs. Just before the pandemic overwhelmed the world in 2019 or thereabout, the Africa Union called for a new public health order. Our heads of states, 2 years later, at the UN General Assembly of 2022, they made a formal statement calling upon governments, multilateral organizations, philanthropies, the private sector, and civil society like yourselves to support the full implementation of Africa's new public health order. This new public health order has 5 pillars, and I'll go quickly through them. One is strong African public health institutions, whether they are for training, whether they are for research, whether they are for intervention, whether they are for resource mobilization, doesn't matter. The first pillar is strong African public health institutions. These institutions will then represent the African priorities at the global level and ensure that the continent can be able to achieve its priorities within global health. And we can stage that to say within global surgery. The second pillar is investment, indeed increased investment in health workforce development. This will ensure that Africa has the experts that it needs to address the unique health challenges that the continent actually has. And this second pillar fits in very well with the theme of this session, as well as the theme of the conference this year. The third pillar of the new public health order is expanded manufacturing of all types of health products, whether they are vaccines or diagnostics or therapeutics, or whether they are non-pharmaceutical products. This will ensure that Africa has increased autonomy when it comes to planning and action for healthcare services, indeed for any health emergencies that may reach the shores of the continent. The fourth pillar is increased domestic investment in the health sector. We all are experiencing, one way or the other, the very difficult situation we are in with reduced ODA from many development partners. Indeed, the many executive orders that have made sure that a lot of the work that has been going on the continent of Africa in global health have been stopped. That's why this increase in investment, in domestic investment within the health sector is critical for Africa to be able to continue to maintain the indicators that have been growing very positively over the last decade or so. But domestic investment is not only money. It includes expertise, and we've been talking about that today a lot. It includes technical resources, whether it is machines or whether it is knowledge, or whether it is facilities, institutions. We need those resources to be part of what is invested locally. It includes infrastructure and networks, and of course, financing itself. But Africa, under this fourth pillar, needs to increase domestic investment within the health sector. Finally, the fifth pillar is respectful and action-oriented partnerships. Partnerships that are there to advance Africa's priorities in health delivery, and in our case, partnerships that actually advance global surgery here on the continent of Africa. The recent developments in the global health financing space are a vindication that we need to fully implement Africa's new public health order. Although this was conceptualized and advocated for before the pandemic, now is really when it is being felt for the need for implementation of this new public health order. When fully implemented, the continent will progress faster when it takes full responsibility for the welfare of its people, when it takes full responsibility for the health of her people. Africa will certainly develop better, faster, when the health sector is within the purview and capacities of the African continent, her policymakers, her experts, and the resources that are there within the continent of Africa. Domestic investment in health should therefore be the primary source of resources that goes into the health sector. Any further support that may come thereafter from friends and partners of the continent will be in addition to what has already been locally mobilized and what has already been locally secured. But how do we get to build surgical capacity, and where can we be able to mobilize the required resources as I have been asked to speak about? Let me make a few suggestions. Number one is building confidence. We must have, and this is the way to build the surgical capacity on the continent of Africa. Number one is building confidence. We must have the public appreciate and understand that we have the relevant expertise, the capacity, and indeed, Uganda in this case, but any other African country would fit very well, that there are plans in place to grow that capacity to ensure that we continue to handle most of the surgical cases that are required by our citizens. The best form of building confidence is experience. When that patient or that client walks into a facility and they are well handled, when that patient, that client, lies on the table, wakes up, and some of the problems that were facing them have been surgically addressed, then they can be the best advocates out there to say that yes, that facility, that particular surgeon, that particular team have the capacity to be able to address the challenges that are being faced by the citizens in that location or in that country. With this increase in public confidence, we will therefore have more of our people placing their health, indeed, their surgical needs in the hands of local experts, and with increased visitations and with increased participation of the public, we will have our facilities becoming more and more experienced and adept at addressing the surgical needs of our society. So that confidence building really needs to come first from us, not just communicating it by word of mouth, but also handling the patients and the clients in a certain way that makes them want to go out there and say good, positive things, and we don't end up with so many wanting to go abroad for relatively minor surgical procedures. The second is documentation. The medical field is unfortunately very poor at documenting what we do. We do very good work, but we never go out there to say that we are doing good work. I guess we are so busy doing the work that at the end of the day we are tired, we go to sleep, we wake up, and some of the good work that we have done become public when there is a crisis. We need to stop that and document what we are doing effectively and share all that good news and good information with everyone who needs to know about it, from the public to policymakers to possible partners, to the private sector who need to be making more contribution to the work that we are doing. People need to know what we have done and how it is impacting positively on the lives and the development of our countries and our continent. We also need people to know what we can be able to do and how much of all these different surgical procedures can be done within country without having to go out. And of course, what the cost of that is going to be to them, and they compare that with going abroad, and hopefully many more are going to stay behind. Let's document and share to let people know what we can be able to do. Thirdly is homegrown training, how we are going to be able to build the capacity. Training outside of the country in some circumstances is welcome, but a lot of the training that is required all the way down to the lowest level of facilities can be able to be done within the country. If it cannot be able to be done within one country, then it could be done in a neighboring country where travel and upkeep is much less than going many thousands of miles away, depending on the complexity of the training that needs to be done. So if we diversified the facilities where we can be able to have these trainings being done, if we improved on the work environments so that our regular facilities can be used for training as well, we will be reducing the cost and we will be building the capacities a lot faster, because a certain amount of money invested will train many more of our experts rather than going very far and you find very few people are being trained. So by having homegrown training, where home is within the country and in the immediate neighboring countries, we can be able to train more people, more experts to contribute to the global surgery targets that we are setting for ourselves. Fourth is to regionalize certification. I think the East African community has this already in place. If you're trained in one country, then you are eligible to work in another country. That means that the cross-border training that I was speaking about earlier becomes not a barrier, but it is easily facilitated because our countries have already gone into regionalizing certification. When you've been trained in one place, you can be able to work in another, and that increases the chances of improving the numbers of those that we need to be trained in as far as global surgery is concerned. Fifth is benchmarking. We benchmark with both those who are ahead and those who are behind. Don't benchmark only with those who are ahead. When you benchmark with those who are behind, you become the source for them to come for training to your place. When you benchmark with those who are ahead, then you get to know where you can be able to improve yourself. But don't forget that you also need to be making yourself available to improve others who may be doing a little bit worse than you are. And if we benchmark these facilities, if we benchmark our facilities with a much more complex facility elsewhere, then you find the gap is so huge, sometimes you start getting discouraged. But if you benchmark yourself with facilities that are not too far from you, then you get encouraged that I can actually be able to reach that next step. So let's benchmark locally, even as we aim to benchmark with those who are really, really advanced in many steps ahead of us, and we aim for that progressively. Finally is mentorship, the way to increase this capacity relatively faster. We need to mentor the younger generation who are willing to be part of global surgery. We need to encourage those who have not yet made up their mind to come into this field, so that we are constantly getting the numbers to be more and more, because the population on the continent, and including here in Uganda, is increasing, and we need more people. By mentoring the younger generation, we ensure that tomorrow we have more global surgery cadres and experts than we found it in our own times. Colleagues, resources are a critical part of what we are talking about. And we cannot be able to increase the numbers, as I've described here, unless we do have the resources and they are accessible to us. I'll suggest 3 ways in which we can be able to secure these resources progressively. Number 1 is through government. And I start with government because the real responsibility of growing service delivery rests with the government. Governments can do this through scholarships, because some of these areas are specialized. The basic training had already been done. Governments can be able to do this through providing facilities that can be used for training. And governments can also be able to do this through mobilizing extra resources themselves from partners that we may not be able to reach on an individual basis. As the PS was saying yesterday, the development banks, for example, could be a source of that. Surgical practice, it's a specialization. And since the government is a big employer in this context, it is crucial that it invests in all the different cadres, not just the one who is holding the knife to cut, but everybody else who is involved in providing the service in as far as global surgery is concerned. And engaging with the governments early so that they understand where you're coming from and where you would like to reach will ensure that in their future budgets, they can be able to accommodate your requests for more and increased resources. So this is one, where we can be able to get the resources to increase global surgery in as far as training is concerned. The private sector, and especially the local private sector, they are many aspects of the private sector that can be able to improve training for us to reach our global surgery targets. For example, private health facilities would like their staff to increase their skills and knowledge. They will pay for those staff, and that resource can be used to improve and deliver on specific training, including for those who may be coming from government facilities and do not have the full access to resources as the private health facilities will have. So private health facilities can be a source by paying for their staff, and those resources can be used to improve on the training that we continue to give. Private practitioners as well, not necessarily attached to any health facility, if they want to improve their skills, they too will be able to pay for these trainings. And faith-based organizations will do that as well, especially those that are running health facilities. Any private sector person who needs to improve on their surgical skills and they are willing to make that payment, then they should be encouraged to do that so that we can be able to get this, the initial funding that is required to keep this training running. And in fact, if we broaden the private sector to include donors, those who are not in the health sector at all, telecommunication companies, banks, different types of industrialists and manufacturers. We need to encourage them to support the process of training for global surgery so that services to their market, services to their clients are eventually improved. And in this way, the private sector, especially the local one, can be a very good source of those funds that we need so badly. Finally is the non-local donors. The non-local donors is probably the most straightforward. Many times we look at that particular category as the one that is the most difficult. In my experience, it is not. The most straightforward are the non-local donors, where those who have had a little bit of experience in engaging with the international philanthropies or international organizations that provide resources. If you have a good idea, you write a good grant, that is the beginning, and that usually is about 30% of the effort. In my experience, money is never given to strangers. So you need to stop being a stranger. And you stop being a stranger in two ways. One is you get to know the right people, and I think the networking that you're doing here is already good enough. And when you know the people and your interest in securing funding comes to someone you know, it is looked at completely differently from if it was someone that you don't know. The second way of stopping being a stranger is being involved within that area of expertise and work. Within global surgery, it is a growing field. Let's be part of it. Let us know who are those who are engaged in global surgery, which institutions, which organizations, and they get to know us and our work. And in that way, we reduce the gap of being a stranger. And for me, the non-local donors, so long as we organize ourselves well, and ASOW is here to be able to coordinate some of these grants that need to be written, we would be very willing, some of us, to knock on doors with yourselves so that we get the seed funding that is required. And for me, it is just seed funding, because it will facilitate the beginning of a process, and then what we can mobilize locally is going to be the real resources that we need in expanding the global surgery program that is hopefully going to take a very good root here in Uganda. And as I conclude, and in case you did not get all that I have said, I invite you to remember these 5 things. The first is that the practice of global surgery is not only important, it is an essential part of global health. It is an essential part of global health. So let us expand the knowledge in global surgery and include it in our daily work. This is one. Second is that there is urgency. There is urgency in fully implementing Africa's new public health order, because within it are very critical areas of improving our health workforce, improving our institutions, and mobilizing local and domestic resources. So implementation of that Africa's new public health order is particularly critical. Third is that building surgical capacity should be a local and a regional effort, where communities of experts, where communities of countries can be able to come together, pool their resources, and get global surgery to be better understood. Then when we get support from outside, it will be based on the priorities that we've already discussed and set for ourselves. We need to have regionalization of these communities so that we work together with people who are relatively closer to ensure that our numbers can increase, hopefully exponentially. Fourth is mentorship. It is the core part of developing a sustainable global surgery program within a country and within this continent. Let us mentor those who are from behind, and let us look for mentors who are going to hold our hands for us to be able to go further. And finally, finding resources to build the capacity and sustain a successful surgical training program is both a domestic and a global affair. Let us do both. Let us not do one at the expense of the other. Both can be able to work, and as we continue to expand our networks, let us ensure that not just Uganda, but indeed the whole continent of Africa will build and succeed in increasing the local passion for global surgery, and will increase understanding and therefore resourcing of this very important area. And therefore I urge myself and you, individually and collectively, that we increase this passion amongst ourselves and those who may not be here but need to hear about it. We increase that passion, and collectively we generate the momentum that is required for this effort to succeed, because together we can be able to do more. I thank you very much for the opportunity.